First of all, let me welcome you all to Medical Terminology 1, MA 1020. Um, and hopefully we'll learn a lot during the course of the semester. It's going to be a lot of words you're going to have to learn. There's a number of words, but a lot of it makes sense because we're going to be talking a little bit later about some of the rules that are really important in regards to making medical terms. And sometimes if you know these rules, words that you may have never seen before, you'll be able to figure out. So let's go ahead and get started. First of all, what in the world is medical terminology? Okay. Medical terminology is basically a medical language. Okay, it's not that we try to confuse. I'm a retired doc, and it's not that we try to use this medical language to confuse patients. What happens? It allows a good communication throughout the entire medical field. In other words, if I'm talking to a nurse, if I'm talking to another doc, if I'm talking to a lab tech, if I'm talking to an X-ray tech, if I'm talking to the dietitian, we all know this medical language. So what happens is it's an easier way to be able to communicate because number one, it's consistent. Okay, everything we do in regards to that is consistent. So in other words, if I say a word once, it's always going to have the same meaning every time I say that word again. So whether it's regardless of which medical discipline you're in, the words are always going to be the same. Okay, so it's very consistent. It's also important because it's both written and verbal. In other words, I could speak these terms, but also as well as I write it. I know when I had been in practice, I had sometimes been involved in some having to write some legal documents in regards to whether there was liability or something like that for another physician, and either for or against. And basically, I had to use these medical terms in there because in the court of law, those words are very specific. They are consistent. They're very specific. And actually, there have been some times when I would actually find that in looking at another physician's medical records, there might have been a word that was used incorrectly, which is sort of, I can't believe how that would have happened. But it's a language. Medical terminology is a language that's both written and verbal, allowing people to both communicate orally as well as in a written language. And so when you write something in a chart, those words have to be correct. Okay. And again, I've seen some situations where sometimes put the wrong word in a chart and it really messes up what really happened. So therefore, it also becomes a part of a medical record because it is in a chart. Okay. The thing about medicine is everything needs to be documented. Okay. Everything you do, everything you see, everything you talk about needs to be documented, both for medical legal reasons as well as to be able to communicate to other people in the medical profession. And the way we use the medical terminology, it's a great way to document. Okay. It's very precise. The words have a specific meaning, and those words are precise. So I mean, a certain type of procedure might be named after various organ systems in a row. Okay, you'll see this later on as we go through the semester, and so medical terminology is a very precise type of a language, and it's also very descriptive. Okay, again, sometimes just by looking at the word, you're able to determine what it is simply because parts of the word will give you enough of a hint in regards to the descriptive meaning of a particular word. So this is a little about what medical terminology is about. Okay, now when we look at something called the medical record, like I just mentioned before, there are multiple parts of a medical record, and you don't have to. And first of all, this is a long list, and you say, "Oh my gosh, I'm going to have to sit down and memorize those." Don't do that. Don't waste your time. Okay. What happens if I look at all these things, whether it's a history and physical, whether it's doctor's orders or something like that, or a physical therapist orders or something like that, nurses orders or nurses notes, progress notes, consultation reports, other types of ancillary reports. Sometime I'd have to give a second opinion, so I'd have to write something in all these medical terms to send back to get a second opinion to someone else. Diagnostic reports, in other words, when we look at an X-ray report or something like that, it's written in medical terms. Okay. Operative reports. When I did a surgery, because I had a surgical residency, and when I dictated an op report, basically it was in very specific operative terms. Not just the name of instruments, but what was actually done and what organs were affected and things like that. So it's very specific. Anesthesia reports. So when the anesthesiologist writes a report, medical terms are in there. Pathology reports. Currently, my wife works in a pathology office, and basically she does a lot of transcription, and it's basically these long words, which are there, and they're very descriptive when you look at them, as well as a discharge summary. Every patient that's in a hospital, and sometimes even they'll have a discharge summary at the end of office visits. Okay. But at the end of a hospital stay, there's usually a discharge summary that the physician and some other people may dictate, a resident or an intern or whatever the case may be, and basically that has a lot of medical terms. And you're saying to me, Dr. Lichnick, you were probably a little bit distracted and you missed one, okay? And you say you missed this one right here, informed consent. And I'm going to put it in red because informed consent doesn't apply to this, doesn't apply to medical terms at all. And the reason why informed consent is, you ever notice if you have a procedure done, and when you have the procedure done, you have to sign a consent form saying that you're allowing the physician or whoever it is to do that particular procedure. Well, that consent form, assuming that the patient doesn't know medical terminology, cannot be in medical terms, or it should not be in medical terms. It should be in simple lay language. So I left that one out because basically that's part of a medical record, of course, because that copy of that informed consent goes in a chart. But on the other hand, it's something that when it's filled in the blanks, there's a number of blanks for a procedure or a test or something like that, it should be in lay terms, or terms that someone who has no idea about medical terminology would be able to they wouldn't know the medical terms, so it has to be very simplistic type terms. I'm going to cut this at this point and take out this piece of bone and put it back together and sew it together. And this is and as a result, what's going to happen is that this might be the risk, and this might be the risk, and this might be the risk, and this might be the risk. And you accept that risk, and fine, you sign, and you say, yeah, you sign away your life. Anyway, that's called informed consent, and basically that's in lay terms. But everything else, history and physical, all the way down, everything in yellow is basically going to be in medical terms. Okay. So again, what is a medical record? Talking a little bit about what this medical record really is. First of all, it's a confidential document. Okay. Guess who has the right to see that medical record? Well, you do. It's yours. Basically, the physician keeps that medical record. But if we're seeing more and more medical systems that actually allow the patients to have a very easy access to their medical records. They could look at tests, they could look at notes and all kinds of other things that are in the medical record. But it is a confidential document. A number of years ago, they came out with HIPAA violations. You ever know when you go to the pharmacy or when you go to a doctor, you have to sign a little thing saying the doctor will not talk about your case with anybody and send out information without your consent and stuff like that. Well, the government came down, looked at medical records and said, hey, you know what? We don't want to have easy access to medical records by everybody. They also did how people treat something. There used to be clinics I've seen where there would be multiple patients in one large room. They'd be treating people in different corners. And you really can't do that, even in like the emergency room. When you had like curtains between patient beds, and they'd go in and they'd ask a patient, hey, what's your problem today? I haven't had a good bowel movement in 3 weeks. You don't have to have the patient next to you hearing that. So the government came out with this HIPAA, which is basically who's allowed to see and what the rules are for being able to transport, or the portability. The P stands for portability. How can those records be sent to somebody else? So the medical record is confidential. If there's something in there that you don't want other people to see, they can't see it. Okay, it's against the law for them to see it. So it's a confidential document in all those situations. Okay, it's an organized and comprehensive database of patient health-related information. When you pick up a medical record, when you get into a hospital and you look at that medical record, you should be able to follow it like the chapter of a book. There'll be certain sections for history and physical. There'll be a certain section for progress notes. There'll be a certain section for lab results, and you're able to go through X-ray reports and all kinds of other ancillary services that are in there, and you should be able to read that, and it'd be very organized and it's very comprehensive. It tells all the information about that patient that you need to know. Not just from now, but even from before admissions and things like that. It's a legal record of patient health information and patient care, as well as health-related services. Again, the medical record, while it can't be conveniently handed off, hey, did you see you should see this crazy patient I saw today and stuff like that. You can't happen that way. Okay, so basically, but one of the disclaimers is that because it is a confidential document, it can be subpoenaed for court. So in other words, if somebody has a certain liability case or something like that, that medical record can be subpoenaed. So therefore, it is a legal document, and it's there, which makes some significant rules in the registry of the medical record. Once you write something in a medical record or enter it, it can't be erased. Once, in the past, when you used to write records, okay, what happens if you made a mistake, you can't erase it and write over it. Basically, what you had to do was keep it, you drew a line through it, and you dated it and put your initials next to it to say that was an error. You might write error with your initials and a line through it. Nowadays, with electronic medical records, if you click on the wrong thing or you write the wrong thing, you could go back and change it. But once you enter that record, once that record is submitted, it can't be changed. It becomes time stamped as to a certain time. So a lot of times I've seen situations where, in a legal case, this is sort of interesting. In a legal case, they get a medical record, and to see if someone's gone back and tried to alter the record, they'll look at the time stamps of all the individual records. And if someone goes back and tries to alter it, guess what? That electronically gets recorded, in the electronic guts of what it is. And so therefore it says, hey, you're trying to, hide something and stuff, and which is basically almost like a no-brainer at that point. But the medical record is a legal record, and again, it can be used in a court of law. So therefore, what this means is the medical terminology that you use in a medical record has to be accurate. You can't make any mistakes. I remember I was provided some medical counsel for a lawsuit, a civil lawsuit, that what happened was somebody was suing a school system for a huge amount of money, on multi-millions of dollars, and basically, which was a frivolous claim anyway. It should never have gone through. But what it was filed. Once it's filed, it has to go to court. Finally went to court, and the school system, which was represented by a lawyer that I worked with at that time in regards to, he sought my help to see if I could weed things out. Turns out that when I went and read the initial physician's record, who actually suggested that the patient ask for a lot of money from the school system, they lost the case. And they lost the case because he was intermingling words that probably shouldn't have been used. It was a very simple case. I read the chart, looked at the chart, says, you know what, he's using this word here, and he's using the word first out of context. He's using the wrong term, and basically it turned out really good, So so it becomes a legal record. A couple other things about the medical record. It provides a basis for continuity in patient evaluation, condition treatment. What this means is that what happens is usually in medical care, you'll see multiple people seeing a patient at different levels, and what happens is any person that has access to that chart could look and see what people did at any particular point. So there is a level of continuity. One of the things that we find in medicine is sometimes the head in the past didn't know what the tail was doing, and that's why people got over medicated. Sometimes what would happen is someone would prescribe one medication, then somebody prescribes, another physician or a practitioner or somebody else prescribes something else that may be contradictory to the first medication, which is not good. So basically what happens is the medical record actually provides a nice basis of continuity, so I could go back and look at it. Most of the medical record system, Cleveland Clinic, University, VA system and stuff like that, basically if you're in one facility, you can see what everybody else that's been in that whole system has done. So it prevents some duplication of efforts. It prevents some contradictory type of things that may be done in regards to medications and stuff. So it's a basis for continuity, which is really important. It's a format for patient planning. In other words, now I have the information. It's very, very simple to be able to go and plan what the patient needs to do. I write that plan out in medical terms, obviously. I write that plan out in medical terms, and then everybody else that has access to that chart is able to go back and look and see what that plan is, if they have to add something or if they might recommend something different. So it's a format for patient planning that multiple people there have access to that particular chart. And again, only limited people have access to that particular chart depending upon who the patient designates to see it or who's involved in that overall treatment. It's a documentary evidence of evaluation, treatment, and changes in condition. So this way, it does have a record of what's happened, when it's happened, how it's happened. So therefore, things can't be swept underneath the rug. Okay, so it's just a nice running tally of what's been going on in regards to any changes in physical condition, any treatments that were added or stopped or something like that, how the condition has changed over a period of time. It's a very nice little graphical text graphic that's basically had to follow a patient's condition through an entire course. Okay, it allows communication again between practitioners and other healthcare professionals. So in other words, if I'm in a system and I want this patient to see physical therapy for some reason, basically the physical therapist will have access. They send them to, with the patient's understanding that they're being going to the physical therapist. The physical therapist will have access to looking at parts of the chart that know exactly what I want. Okay, which is also a nice thing. Also, usually when I used to write an X-ray requisition, at one place all the X-ray requisitions were written in the computer that went automatically to the X-ray department. Well, the X-ray department then had access to that, so it allows me to communicate. And I used to do a very long description of what I was looking for, so that would help the X-ray tech and the radiologist know actually why the person was getting that X-ray and what and it actually helped in sometimes in regards to what positions were ordered and stuff like that. That's a long story about that. It's also protection of the legal interests of the patient, the hospital, and the practitioner. In other words, yeah, sometimes there's malpractice situations, and those things all of a sudden, may come up, and therefore that's sort of like the legal interest of the patient. The patient, has this record that the physician usually holds, but you do have access to that record. That record then could go to the lawyer for any type of determination as to whether there's some type of a lawsuit or not. They usually call in another practitioner to look at it to see, is this something good or something bad, and if it's not, they'll go whichever way the wind may blow. Also, it's also helpful for the practitioner in the hospital. In other words, if you have a patient who's particularly reckless and careless, what happens is, let's say they have a bad outcome. They've had surgery, they don't take care of themselves, they've done some bad things and stuff like that, and everything has been documented by the practitioner or some representative of the hospital, and as a result, what happens, the patient didn't follow that could be seen in the medical record. So as a result, it would be, if there's a lawsuit or something like that, they may be thrown out. So it protects all interests, the patient, the hospital, and the practitioner, so which becomes the basis for good entry into medical records. Okay, and again, when we look at this whole system down here, I'm sort of in the way, I apologize for that. But when we look at that, here's the patient up in here, and here's the medical record. If you look at all these arrows seems to want to point one way or the other. They eventually lead down the medical record. Therapy planning to investigation planning, now everything leads to the medical record. So all basically it says here, everything gets down to the medical record, and that's an important part for everything. Again, and some other primary purposes of a medical record is for the practitioner to be able to present in very specific medical terms, various specific complaints and symptoms. Okay, a lot of times symptoms are actually entered into a medical record in quotes as the patient might say them. Okay, or they may be written in some more complex medical terms. But sometimes, they have a thing. Most histories in physical start with what's called a CC, or chief complaint. And a chief complaint is basically an exact duplicate, or sometimes a very close paraphrase of what the patient tells you is wrong. After that, most of the things, even symptoms. I should mention what a symptom is. The symptom is basically a medical term that means what the patient feels. Okay, what they're complaining about. It's something that is a very subjective type of a thing that the patient says, I had abdominal cramping. Well, that would be a symptom. The patient's telling the practitioner some type of a symptom. Okay, it's also a listing of and the difference between symptoms what the patient tells you. A sign is what the doctor or the practitioner will actually see by examination. Okay, we know that the medical record also is a listing of diagnostic investigations. So therefore, not just what's ordered, but the results of all those. So if someone wants to look and see what they saw on an X-ray or on a special test or a stress test or a scan or something like that, that will all be written in there, again, in medical terms. So you have to both understand those medical terms to be able to interpret that particular record, okay, and what's really saying. A list of possible and confirmed diagnoses. What happens, there's something in medical records that's called a differential diagnosis. And what happens is, as a patient is seen and they get a chief complaint, then they go through this history and physical. And at the end of the history and physical, the practitioner will sit down and say, I think these are the things that are possibly going on. Okay, sometimes it's almost like a dead given. Yeah. If you have like a knife sticking out of a chest, guess what? It's knife wound to the chest. I mean, that's really simple. But on the other hand, sometimes things like abdominal pain could be a lot of things. It could be appendicitis. It could be just intestinal flu. It could be a diverticulosis. Diverticulitis. It could be a kidney stone. It could be lots of things. So they make a long list of things that are called differential diagnoses. All the things that are possible. And then by various types of diagnostic investigations, they either rule things in or rule them out. Okay, so what happens is this listing of possible, which is my differential, as well as my confirmed diagnosis, which would be what's called the final diagnosis. It's the last thing, and that's what they're being treated for, that confirmed diagnosis. And that's on the medical record. It's a record of treatment. Okay, what's going on, what's been done, and so that way people don't duplicate things. Okay, so that's an important thing. We know the medical record is a summary of episodes of care. So what happens is every time someone comes in to see a practitioner, they sometimes get something, okay, and this is, I'll write this down here, it's called a SOAP note. And that SOAP doesn't mean clean. S stands for subjective. We talked about those are complaints that the patient tells you. O stands for objective. Objective are signs, are things that the practitioner sees. A stands for assessment. Okay, what do you think is going around? I better continue that, otherwise that's going to look bad. Okay, assessment. And P stands for plan. Okay, so basically a lot of times when they do a follow-up in episodes of care, summary of that, they frequently write what's called a SOAP note. So if you hear something, hey, I'm writing a SOAP note, don't think it's because it's it's something about cleanliness or anything like that, but basically it's subjective, what the patient says, objective, what the practitioner sees, assessment, what they think is going on, and P, plan, for what they plan to do. Okay, so the medical record has this summary or episodes of care. It's also a communication, like I mentioned before, between healthcare professionals. Okay, so therefore what happens is one professional, if they're able to look at, if they have the access to be able to look at that particular record, could see what everybody else has done. Okay, whether it's good or bad, they could still see what everybody else has done. Okay, so that's basically what this medical record is all about. I think the important thing to remember is, and hopefully by telling you the importance of a medical record and telling you the importance of being able to communicate with other people, you sort of, at least subliminally, hopefully, subliminally, you're thinking how important the medical record is. You're thinking how important the medical record is. You're thinking about the fact that the medical terminology, which is a large portion of my medical record, because it's again a very precise, very informative, consistent type of language, you're able to it's important to have some precision with what you write, So in most medical practitioners, whether they be in the dietary, whether they be in physical therapy, occupational therapy, x-ray, as a physician, as a nurse, whatever the case may be, guess what? You're going to be writing in these charts. You're going to be making chart entries. My wife recently had some surgery and from a friend of mine, and basically, we've had post-op visits and stuff like that, and basically, the medical assistant that's in there is typing in some things in the medical record that has to be in medical terms. Okay, so medical terminology is, if you're intending on going into anything, some type of a medical field, it's important to understand these words. You can't mix them up. You have to understand them. It's like learning any other language. Yeah, there's a number of words you have to learn, but there are a lot of ways that will help you by how words are put together that could give you some ideas as to what the terms actually mean without ever having seen them before. Okay. We'll talk a little bit more about this in a subsequent video in regards to what is a word root. Word roots become sort of like the center portion of a word, the major focus of what a word's about. But then what happens is every word root has to be finished off, and every word is finished off with what's called a suffix. Suffix, like in English language, is at the end of a word. So these suffixes are put at the end of the word. So word root is followed by a suffix, and sometimes, but not always, something's added to the beginning of the word, like we have in English language, called a prefix. If I know my word roots, what my word roots means, and there's tons of those. There's lots of word roots, and during the course of the semester we're going through multiple different sections of all kinds of different word roots. If you know what the word root is, you have a general idea what we're talking about. In other words, just for an example, if I see a word that has cardi, C-A-R-D-I, in the middle of it, I know it has something to do with the heart. Okay, if you see gaster, G-A-S-T-R, you know it has something to do with the stomach. Okay, and then what happens is word roots are followed by a suffix because you have to finish it off. You can't just leave a word root dangling. You have to finish it off with a suffix. And then maybe to make that word even better, you add a prefix. And this is what we're going to be talking about in our next video, talking about how words are put together, you know, with word roots and what we call combining forms, because certain vowels have to be added. And we'll talk about these rules in our next video. Word roots, and then we'll talk about suffixes, and we'll talk about prefixes and putting these things all together. And that's what you have to look forward to. Okay. And again, it's a lot of fun. It's a lot of exciting. A lot of these words, and hopefully by the end of the semester, you'll have a lot of words under your belt that you're able to talk about. So until next time, that's a little bit about a medical record, and we'll see you soon.